The pace of change in healthcare has accelerated exponentially in recent years. Medicare now requires physicians to demonstrate the quality they bring to patients through its Quality Payment Program, or QPP, and the CMS is modifying the rules every year as the program gets more complex and moves toward full implementation. Navigating all the changes every year can be daunting, and it's giving clinicians a headache. The College of American Pathologists continually advocates to ensure there is flexibility to effectively participate in payment models such as QPP. Here's what is implemented by the CMS in its Quality Payment Program. Through the QPP, the CMS has established a value-based payment program that intends to focus on quality instead of the quantity of care. There are two tracks in QPP. The first is called Advanced APM, or Advanced Alternative Payment Model. The CMS's intent with the Advanced APM is to incentivize providers to take on financial risk related to patient outcomes and cost of care to improve quality and cost efficiency. You can participate in QPP via an Advanced APM if you receive 50% of Medicare-covered professional services under Part B, or see 35% of Medicare patients through an Advanced APM. In addition, 75% of practices need to be using certified EHR technology within the Advanced APM entity. Participation in QPP through an Advanced APM offers an annual incentive of 5% from 2019 to 2024. The second track in QPP is MIPS, the Merit-Based Incentive Payment System. This is the QPP track that most pathologists will likely be subject to, as it is the default option unless one qualifies for an Advanced APM. MIPS adjusted payments are based on a final score, which is determined by reporting on measures across 4 categories and then compared against your peers. Your final score in 2019 will determine your payment adjustment in 2021, up to a 7% bonus or as much as a 7% penalty. For most clinicians, MIPS will weight performance across 4 categories to determine final scores in 2019. But for pathologists, the 2019 category weighting is a little different. Your final score will be based on only 2 categories. That's because in most cases, pathology is not considered a patient-facing practice, so pathologists are not required to report on the Promoting Interoperability, or PI category, and CMS is not able to calculate cost, as the cost measures are not applicable to pathologists in 2019. This also means that the weighting of the quality category increases to 85%. In 2019, the CMS added a new facility-based scoring option. Under this option, quality and cost scores would be assigned based on your attributed facility's hospital value-based purchasing program. However, facility-based pathologists can also report separately as individuals, and the CMS will use the highest score. To be excluded from MIPS based on a low-volume threshold, clinicians and groups must meet one or more of the following 3 criterion. Have $90,000 or less in Part B allowed charges for covered professional services, or provide care to 200 or fewer Part B enrolled beneficiaries, or provide 200 or fewer covered professional services under the Physician Fee Schedule, or PFS. Starting in 2019, clinicians or groups can also opt into MIPS if they meet or exceed at least one, but not all 3 of the low-volume threshold criteria. The MIPS payment program is budget neutral, so it is a zero-sum game. Some participants will earn an incentive, while others will receive a negative adjustment, and still others will fall somewhere in the middle and essentially break even. Your 2021 payment adjustment is determined by your MIPS final score set by the CMS and where you fall on the performance threshold, which is set at 30 points by CMS for 2019. This means participating in MIPS by attesting to improvement activities only no longer enables you to meet the score threshold for avoiding a penalty in 2021. If you are eligible to participate in MIPS in 2019, you must report 12 months of data on the quality measures applicable to your practice for at least 60% of patients applicable to each measure, and attest to 1 high-weighted or 2 medium-weighted improvement activities for a minimum of 90 days in 2019 to avoid a 7% penalty in 2021. Only QPP and QCDR measures approved by CMS can be used for reporting quality measures for the quality category of MIPS. If reporting via claims, you can report on 5 QPP pathology quality measures developed by the College of American Pathologists and attest to performing improvement activities like population management and patient safety and practice assessments. One important change in MIPS in 2019 is that if you are in a large practice of 16 or more clinicians, you can no longer report via claims. You will have to find another mechanism, such as a qualified registry or a qualified clinical data registry, or QCDR, such as the CAP's Pathologists Quality Registry. The Pathologists Quality Registry developed by the CAP allows for 21 additional pathology-specific QCDR measures outside the QPP program to be reported for the 2019 performance period. So why be subject to penalties? Start preparing to report now by contacting the CAP at registry.inquiries@cap.org. We hope this helps you make sense of the CMS's QPP program. Because when it comes to keeping pace with the changes in healthcare, it pays to be in the know.